You will now watch several phlebotomy procedures. These practitioners have done their first blood drawing just after the theoretical course you've just attended. And you will see that the success rate is actually quite high. Obviously, there are some small mistakes that we will correct together. Let's analyze the first case of blood drawing. Here, the dental surgeon is placing the tourniquet above the elbow crease. A small critique though, the bandage is stuck on the wrong place. See how inconvenient it is to have it on the fingers? It's better to have it on the back of the hand. After putting alcohol, palpation is performed to choose the best vein to prick. Here the surgeon is using the pen to draw his vein guide, and he's taking the time to put points exactly where he's feeling the vein. Very good. At this step, you can use the vein light to check the accuracy of your vein guide. Then hold the needle, remove the plastic needle cover and prepare yourself to prick. To be more comfortable, pull the skin with the thumb and at about 10 cm of the puncture point. Very good, we see the blood backflow, the bandage can be applied and the tube can be connected. The feeling is fast, it's perfect. There is no need to hold the butterfly needle. It's exactly the aim of the bandage. Once the tube are filled, remove first the tourniquet. Good. And for the bandage, use the fold that you've made at the beginning of the procedure to remove the bandage easily. Prepare your finger above the bandage and press only when the needle is out. Don't forget to retract the needle to avoid pricking yourself or the assistant. See, for a first ever phlebotomy, and despite really small mistakes, it's a success. You can do it too. Let's see another procedure. The bandage is already set on the hand and the tourniquet is well tightened. Perfect. The surgeon is applying the alcohol and the tapping will hit the skin and increase the vein volume. Remember that this step is mandatory for disinfection, but also to make the vein always bigger, always easier. Then he takes the pen to draw the points of the vein guide. And it's good, we see that the points are precise, and so the guide will be precise. We now have a visual marker of the vein. The vein light is used to control the vein guide, and we see that the points are exactly on top of the vein. It's a good vein guide. Pulling the skin, good. A small critique though, the needle insertion could have been faster. Remember that the slower you go, the more uncomfortable is it for the patient. But it still works. He's inside the vein, we see the blood black flow, the bandage can be placed. Tube connecting, good. Be careful, when you hold the tubes, do not pull on the tubing. You may risk to move the needle or even go out of the vein. He's removing the tourniquet first, perfect. But for the needle withdrawal, I had to stop him. Indeed, the bandage hasn't been unstick properly, and he was about to remove the needle and the bandage. Press on the puncture point and remember to always retract the needle immediately to avoid any accident. The third case. The attendee is placing the tourniquet. Good. Bandage is already on the hand. Then she's pouring the alcohol on the skin to tap it and increase the vein volume. Here the veins are well visible, thus there is no need to clench the fist. Big mistake here. The guide is placed without palpation. She's placing point where she sees the vein, but not necessarily where the vein is. And you will see it can put you in tricky situation. Another small error. The equipment hasn't been prepared in advance. Everything has to be open when you're about to do the phlebotomy. This way, the tourniquet doesn't stay for unnecessary moments. To remove the plastic protection, I told you, you need to do a rotation movement. Hold the wings and remove it by a rotation movement. If needed, don't hesitate to move the patient's arm to be comfortable and in the right axis. Force yourself to pull the skin at 10 cm of the pricking area. Okay, she's pricking, following the guide. There is a blood backflow, so she will apply the bandage. But when she connects the tube, nothing happened. And what do we see in the tubings? Some blood and then nothing. So what could be the issue here? There was blood, so at one point the needle was inside the vein. And then it wasn't anymore. It means she either went too deep or too far. In those cases, no worries, by just withdrawing the needle on a few millimeters, you should be back in the vein. And see the tube fills within the second. By letting the tube connected, you have an immediate feedback of what you're doing. If the filling resumes, it means that you are inside the vein. You can go on. Tourniquet removal first, perfect. Once again, she was going to remove the needle together with the bandage. Make sure that the butterfly needle is completely on stick. Press on the puncture point and ask the patient to close the arm. In this case, the wrong guide placement. It was visual, but not by palpation. It almost made her fail the phlebotomy. If something abnormal happens, do not panic. Take a deep breath and analyze the situation. If you understood what you did wrong, you can easily correct your mistake and finally succeed the procedure. Let's move on with the fourth recording. Bandage and tourniquet check. Alcohol is applied and the skin is more than tapped. He's choosing the cephalic vein in this case, and we see that the guide is well placed. We see that the surgeon takes the time to draw precisely the point. But for this second vein, the vein guide has been placed without palpation. Here it's okay because this vein will not be chosen. He used the vein light to control its blood placement, and it's okay. A small comment here. We see that the plastic cylinder covers partially the needle. This plastic cylinder is movable. Make sure that the needle is fully out. Anyway, it still works. We have blood backflow and the bandage can be stick. And see how effective is the needle immobilization. This is a very useful gesture. At the end, the tourniquet is removed, but the bandage fold hadn't been done at the beginning, and see how impractical is it to remove the bandage without its fold. Prepare your finger above to be ready to press the puncture point after needle removal. The faster you withdraw the needle, the less the patient will feel something. To retract the needle, open the wings and pull them towards the bottom, like this. Perfect. Let's continue. Once again, the bandage is already set on the back of the hand and the tourniquet is properly tightened. Alcohol, okay. And tapping. The points are carefully drawn. It's very good. Remember that you can move the arm if you want to be in the same axis of the vein. And force yourself to pull the skin with your thumb at 10 cm. Here the needle insertion is a bit slow. Check the blood backflow. If you see it, you can stop there and stick your bandage. Speaking of bandage, when you prepare it at the beginning, remove the two lateral adhesive protection, because removing them later will be inconvenient. And then connect the tubes in the tube holder. Once again, there is no need to hold the butterfly needle. The bandage is doing it for you. After removing the tourniquet, unstick the bandage to free the wings. Quickly withdraw the needle and don't forget to press on the puncture point. And ask the patient to fold the arm for a couple of minutes. Another case. The tourniquet is tight, it's perfect. Alcohol is applied and the skin is tapped even more than necessary. The palpation allows you to choose the best, the bigger vein to prick. It's a very important step. See, she's really taking the time for the palpation. It's a very good thing. She really wants to be sure to choose the biggest vein. And she's making every effort to draw the vein guide points exactly where the vein is. Once again, the equipment hasn't been prepared. Open everything before beginning the phlebotomy procedure. The tubes and the needle. You don't want to lose unnecessary time. I repeat it every time, but it's a very common bad habit. Use your thumb to pull the skin. And when she's pricking, we see that we have no blood backflow. Let's analyze the situation. If you palpate above the needle, you see that the needle actually doesn't follow the vein guide. So she has to correct the axis to follow the guide and be inside the vein. But we see that she didn't succeed. Indeed, the needle is still in the wrong axis. To properly correct the axis, first you need to pull the skin, and you need to withdraw the needle a bit, but without getting out of the vein. Remember that the tourniquet is still tightened above. See, I pull the skin, withdraw the needle a bit, and this time correct the axis. We have blood backflow. We can finally stick the bandage. If the feeling is slow, like in this case, try first to pull on the skin. If it doesn't get better, it means that the needle is not properly in the middle of the vein lumen. Withdraw or push a bit further the needle to retrieve a central position. See, now the flow is fast and it's perfect. She removes the tourniquet first, good. Once the needle is withdrawn, immediately press on the puncture point for hemostasis. Prepare the finger and press once the needle is out. Don't forget to retract the needle as soon as you've finished. To retract it, slide the wings towards the bottom. When you meet failures, always analyze the situation. If you don't have blood backflow, something happened. Sure, it's good to draw a good vein guide, but it's even better to follow it. The lesson seems learned, first the bandage and then the tightened tourniquet. Alcohol. Be careful, the guide hasn't been placed with palpation. It's a big mistake. A guide without palpation has no value. Don't be influenced by what you see. Again, use your thumb to pull the skin more effectively. Luckily for him, it worked this time. There is a blood backflow, so he can put the bandage. The filling is fast, it's perfect. Be careful not to pull on the tubing, you may risk to move the needle. First tourniquet removal and then the needle. To retract the needle, I told you, hold the wing open and slide them towards the bottom. And it's another success. Let's see venipuncture number 8. The surgeon is placing the tourniquet. The alcohol and taps. Good. He's palpating and selects the best vein with palpation. He can now draw the guide. When you hold the needle, the bevel should be facing you. Once again, use your thumb to pull the skin. It's much more efficient. He almost forgot to apply the bandage to immobilize the needle. We see that he has moved a bit, but luckily it's still inside the vein. Make sure to immediately stick the bandage once you're inside the vein. The filling of the tube is fast. It's another success. He removes the tourniquet first, but here I had to intervene. He was about to remove the needle without completely unsticking the bandage, and thus risking to remove everything together. Make sure to completely unstick the bandage before removing the butterfly needle. slide back the wings to retract the needle. And let's finish with this case. Bandage is prepared, and the tourniquet, I told you, it has to be tightened strongly. The alcohol is here to increase the lock-in temperature and thus the vein volume. It has to be more energetic than this. The guide was about to be drawn without palpation. Use your finger to tell you exactly where is the vein. Here he corrects himself. Very good. Remember not to use fulcrum. Fold the fingers to have the right needle introduction angle. Perfect. Stick immediately the bandage once you prick. You don't want the needle to move. Again, the bandage is here, so there is no need to hold the butterfly needle. Remove first the tourniquet and then the needle. Don't forget to press on the puncture point before asking the patient to fold the arm. I think that you understood that with this protocol, this particular technique, it is easy and easily reproducible to perform phlebotomy. Obviously, at the beginning, you will encounter some difficulties. Don't be discouraged, because like in any new technique, there is a learning curve. But in this case, it is reduced. I remain at your disposal to answer all of your questions. You can write me on the following address: info@prf-education.com. My friend, now it's up to you.